Hi everyone. I just wanted to take a moment to introduce myself to you all. My name is Peter Smulowitz. I'm here as your new, or relatively new, Chief Medical Officer, and I just wanted to say thank you all for the opportunity to be your Chief Medical Officer. It's been wonderful to be here since the beginning of November and to be part of such a wonderful, fantastic community at Milford Regional. Before starting here in November, I spent about the past 14 years or so as part of the Beth Israel Deaconess, or now Beth Israel Leahy system. Mainly in a clinical role as an emergency physician. I still practice clinically here, and some of you, if you ever do need to seek care in our emergency department, might find me there, continuing to provide care to people clinically, but also developing over the past 14 years in a role through a variety of leadership roles within emergency medicine, throughout hospitals within the Beth Israel Leahy system, most notably and most recently as chair of emergency medicine at Beth Israel Leahy Hospital in Needham. The other thing I'm really proud of mentioning to people is that in addition to the clinical and leadership aspects, I've been involved in a number of research activities over the past 14 or 15 years, really engaging in investigation and research about the healthcare delivery system that allows me to have a unique perspective on how the healthcare system works and how we can make it better, or make it work better for all of you. When I started here in November, I think it was hard to imagine what a difficult, what a challenging time the last couple of months was going to be for us here. None of us really expected the extent of COVID-19 cases that we had during this second surge of COVID-19. And I guess I would say that I'm absolutely grateful for all of the people in this hospital who have tirelessly put in hours and hours of work, always trying to provide care to help people in this community who've been sick with COVID-19. There is absolutely no way that we could have made this through without the individual efforts of every single person in this hospital. And I just wanted to take a moment to thank them. There is just an unbelievable amount of gratitude that I think we all need to have for all of the people on this facility who have worked day in and day out to make sure that we've taken care of every single patient and kept them as safe as we possibly can. While the past couple of months have really been challenging and a struggle, both for everybody working in the hospital and for the community, I do want to take a moment just to reflect that there is a ray of hope out there. Not that we see this coming to any end anytime soon, but with the vaccines and the promise of the vaccines and the promise of people being immune to COVID-19, I think all of us are finally grasping at that hope that there will be an end to this and there will be some return to life as normal. And for that, I'm grateful that we have the opportunity to be administering the vaccines, to be part of that process and allowing us to return more towards life as normal. Now that there's been at least a little bit of space to breathe as the number of COVID cases have come down, I've had a chance to really think more about what my vision is as your Chief Medical Officer. And for those who have met me already and gotten to know me, they know that I like to think big. That said, I do think that the vision for my role as Chief Medical Officer and for what I want to build here at Milford Regional, or frankly, build on here at Milford Regional, is pretty simple. And that is to continue to deliver the best quality, safest care for every single patient that walks through this door. And secondarily, to make sure that every patient who comes in here feels like they're the only patient in this hospital. You should all feel special as a part of our community. But to do that, to take care of all the patients that walk in our doors, and by the way, their families as well, we also need to take care of the people who work here. Obviously, as the Chief Medical Officer, I'm mostly responsible for the welfare of the physicians and the advanced practice providers, but that doesn't diminish the importance of all of the people that work in this institution. But to take care of them, and to allow them to think about not the logistics of the work they have to do every day, but allowing them just to take care of the patients to the best ability they have, that will then allow us to really make sure that we're focusing on delivering high quality, safe care to all of you. And I'm just grateful for the opportunity to be able to help to build on that here at Milford Regional, a place that for many, many years has delivered high quality care. And I hope we can continue to build on that for decades to come. So thank you.